Hi, this is Dr. LOKESH. I'm presenting today regarding formative assessment, nationwide examination. Uh, this been there for all 100% MCQs, computer-based, um, nationwide since 1960s. I'll present the data. I'm going to share the presentation. So, formative assessment examination by NBMES, no pass-fail examination. Is for postgraduate students. It is also in the USA, it's called in-training examination, different name, but and requires 100% MCQ computerized, and will give the reasons why it could be considered implementing in India. We request the DNB format assessment exam, approximately 200 MCQ. Board can decide the number of MCQs. No pass fail, so student won't be will be it's more learning process rather than pass or fail, and eventually leads to 100% MCQ, multiple choice final theory examination for all postgraduates and super specialties. So those are the global norms. So that's the reason. Like other world can look at our examinations comparatively. Is the students prefer? Absolutely. We have done students prefer 100% MCQ online. We have done published two studies in India. More than 6,000 MBBS students took the survey, and they all liked it. And because and also it is not biased by examiners and uniform standards across country, and less chance to copy and no pass failure. And eventually, the final exam pass rate is up to only final exam pass is 90% pass rate was, I'm going to share the data. Is the student ready? Yes, yes, yes. This is a publications to, and also recently, a week ago, we published again. And also, if you look at CBSE 12th grade students in India, they're already moved to 60% MCQ theory format. So already India is moving forward significantly in high schools. So this is in Calcutta, but again, CBSE around India also changed MCQ format. Yearly PAT exam, is it only for first years or second year, third year? Is it different examinations? No. So only 200 questions, but they all first year, second year, third years take the same examination. And even faculty in USA take the same examination. Faculty also encouraged to take the exam because this new knowledge, new learning is a continuity learning. Is present in any country? Yes, USA it has present since 1960s, and usually there may be up to 150 some subjects, some up to 300, some are 4 hours, even up to 8 hours exam, and the board can decide which is more appropriate for India, and same exam for all 3 years. And India, USA have 40% specialties have annual exam, averaging 200 MCQ formats. And even Australia, UK, Europe has format assessment different subjects. This is the NBME. So currently, board specialty second year, the DNB nationwide they will conduct by NBE, but first year and third year local hospitals does that. In case of diplomas, you have 1 year by NBE, 1 year by the local college hospital will do that, and even specialties have NBE. So these are all essay short courses, not the MCQ. Fees is there is 6,000 rupees this MBE per format assessment. The reason I mentioned fees is this implementation does not cost you either from students or the hospital or faculty. It will be the one, and I'll show some other data here. Fees for FAT theory exam, similar to theory exam, India conducts. And now, eventually, if this implemented, not only it limit to the DNB, it can be NMC can take over MD, DM, MCH. Almost 300,000 students, like 100,000 PGs per year, 300,000 students may need these examinations. So this is significant work there ahead if it can be implemented successfully. And what is the different current NBA, MES, FAT versus ESA? Um, in currently NBM is only conduct 1 out of 3 years of exam, but yes, every year they will be conducted, um, and 2 years by local colleges, but every year is national exam. Currently, essay short course MCQ, but these are all 100% MCQ concept oriented. Bloom's taxonomy level 4 and 5. Comparison is not possible in India because of their evaluation. Here you can compare computerized, non-biased. Um, Feedback can be present. You can compare from hospital to hospital, college to college, universities, and even for the quality to internationally in the future. And here different content in each year could be, but the content is the same exam for syllabus specialties. Because you take the exam in first year, so students read all the subject around, not limited only certain things. First year can be exposed to any cases, same exam for all 3 years. Which specialties F18 years, say almost 35 to 40 subjects, almost everyone has MCQs, formative examination. This is internal medicine, or called we now India we call general medicine formative. What is the reason? This is a self-assessment tool, identify learning gaps, the compare residence with PG's peer performance, help and inform career choices, and tune enabling program directors or HODs to provide educational counseling to residents, developing curriculum. So it's ongoing work. So history, when you go back to history, 1963, orthopedics started in training examination, and there are 275 multiple choice questions. They test in 11 domains. Each subject have different domains. For example, basic sciences, ankles, hip, knee, oncology, etc. So that's what they test. It's been there since 1963. And no pass, no failure. Here again, family medicine, which is a significant number of PGs in America, there's no passing score. It's assessment only. And and also, who are the passing people in the future? The raters are asked to imagine what a physician who is just barely qualified to be considered board certified would be able to. Each question is scored according to the probability that this abstract physician will correctly answer it. So they put a benchmark. As long as they reach the benchmark, they will be fine. So that's why that's what the quality they're looking for. And again, the family medicine is exam presents 1980 in almost 44 years. And if you look at the pediatrics, also have it. Their exam is 150 questions, and is designed abbreviated and is a shorter version of full examination. Content outline allows residents to familiarize themselves with ABP exam, and so pediatrics also use and they assess progress. Usually, students first year will less score every year. They increase the score. Surgery also have since 1975. They published also in American Board of Surgery. The increasing wide use of examination and its favorable acceptance by program director HODs indicate exam is making a significant contribution to surgical education in the United States. So this is again surgeries, and they also publish history. Pediatric surgery, um, pediatric surgery, also in training examinations, and they have the 200 multiple choice. The Europe also have pediatric in training examination. Um, OBGYN, they published again 1996 to 2000 years, and what kind of colleges, what kind of exams they did. They studied this publication, showed 6 published exams they took, and 7 consequent years analyzed. And in training exam appear to be dependable measure of residents improving cognitive knowledge. So there is evidence, there is a publication. And internal medicine is a big number of residents are higher, and they also web based now. Urology, the urology in America is a 5 years program, and they also in service exam. They also conducting oncology because the oncology cases are much higher. The different examination they're conducting. And again, conclusion: American Urology Association is good in training exam is good predictor of performance. Canadian American specialty exams with the strongest correlation. Finally, residency. So they look at the scores. The first year they do less scores. Second, third year higher score. The high as third, fourth, fifth year the scores related to the boards. So there's so many boards are there, 24 boards in America, and are some of them India has much more, like almost 40 boards, and we need to have the examination that many members. So revenue, which I mentioned before, there is a NBE which conducts the UG exams, yearly revenue $198 million. FSNB, ECFMG 72. But look at these under pediatrics, surgery, neurology, and all of them, significant amount of income from the examinations. So what I'm trying to say is there's revenue generation, but that will give more employment in NBE and more research, a more robust examination. It is not a burden to the government. So internal medicine again is developed. How do they develop? They have 11 expert physicians, authors, and they use other program director exam administration annually. So every subject they take expert physicians. They make a committee. And when do they conduct exam? There's a 40 different exam. They probably they conduct 1 week they give a period of 1 week. They can take the exam that week. Again in internal medicine, general medicine, August and September. So this is a website of internal medicine. Exam administered August and September, and they can choose 1 day or multiple days. So they give their information. After the exam, results will be given in 5 weeks or sometimes earlier. So we request NBMS FAT exam, 100% multiple choice exam. You have significant amount of doctors there around. You have 705 colleges. You can, and I want to mention the UWorld, one of the graduate from Osmania Medical College, and he created UWorld, and most of the MBBS medicals, even Harvard students follow this for ESMLE, and they have formats for I think family medicine, internal medicine too. FAT exam is designed to identify self-assessment knowledge gaps. So that's the main reason. It's web-based and where the residents can need extra assistance. And this is the same thing postgraduate to assess strength and weaknesses progress year to year. HODs can use results to provide counseling and remediation. And we have so many specialties. So NBA currently may have more than 30,000 PGs, but if you add the NMC, you're talking about 300,000 students. High quality examination. Questions, we already mentioned this. And the pros, no pass failure. Students will not afraid to take. You get metrics to the NMC or the NBE, get metrics on the student knowledge, and it will satisfy World Federation medical education standards, and which compares the AKT of MRCP and ESA board exam. And with the in workforce creating item means the questions that we need to there is a learning curve. Once you start 1 year, within 3-4 years you can slowly all the faculties start learning item writing, and psychometrics we need assessment designers who will present in this how to and in a different topic, different presentation. So now the way they conduct is they conduct the volunteers sending the questions in ESMLA, and those questions are filtered in the NBE and ESA. We have significant faculty. We can take the AIMS. We have the you can take 5 faculty from each departments, and we have thousands of faculty we can use in India. NBE has several employees. So again, they have IT employees. You can outsource the IT employees. Psychometricians are there. Item writing sessions. And this is all about NBE, how they conduct in USA workshops. And the way finances I mentioned before. And we also have NBE, they have subjects like, for example, in general medicine, they give percentage of scores in each subject, like cardiology, dermatology, each percentage is like every specialty has some domains. So those are the ones I already mentioned. And this is about general medicine. This is pediatrics. These domains are different percentages. And so even basic sciences exam, 20 physiology, 20%, epidemiology, 10, diagnosis, management. So NBE can decide, the committee can decide what percentage you like to give. And psychiatry, again, the domains are and percentages were here. And this one I mentioned about the pass rate, 83% of the allergy immunology versus 95% anesthesia. Most of them hovering around 92%. Again, these are 90% pass rate. All the boards, it took me, I went to each website, collected this data. And again, 90% pass rate. This is what average pass rate. And all these rheumatology, 90%, 90%. So I'll stop here. And this is basic information. And I really appreciate for your kind time and looking at this presentation. Thank you. Namaste. Namaste.